I don't know about you, but as a therapist, I love having really close long term relationships with therapy clients. Maybe you do too. And one of the things that I've learned through my experience as a therapist over the years is that these relationships can be so powerful, fulfilling for us, also genuinely beneficial for our clients, but that it can also be kind of easy to get complacent when we've known a client for a long time and run the risk of thinking we know things about a client, making assumptions, when in fact our clients have changed and evolved, and maybe we've gotten, I don't want to say lazy, but out of the habit of assessing as carefully or frequently or as deeply as we would with a client that we didn't know quite as well. So, on today's episode of Love, Happiness, and Success for Therapists, we're going to be talking about this very important clinical skill, why therapists need to always be assessing, and how that helps you uncover hidden layers of growth and challenges and opportunities for your clients over time. If this is your first time here, I'm so glad you've joined. I'm Dr. Lisa Marie Bobby. Like you, I'm a therapist. I'm an LMFT. I am also a licensed psychologist. I'm a board certified coach. I'm a clinical supervisor. I'm the founder of Growing Self Counseling and Coaching. And one of the things that I have discovered about myself over the course of my career is that I just love being a support person and a mentor to other people in the helping professions. I find it very rewarding. And so that's where this podcast came from. Love, Happiness, and Success for Therapists is just my way of contributing to our community of helping professionals. And so I make these for you. I wanted to speak about this topic at hand because I know in my own career as a therapist and also in working with supervisees, we can be confronted with these like sleeper situations, right? Especially clients that we think we know where stuff emerges and can surprise us sometimes. So on today's podcast, we're going to be talking about different strategies that you can be using so that you are doing a good job staying aware of things that are going on so that you can be truly helpful for your client, but also reduce the risk of stressful, surprising, or situations that you might experience that after the fact you say, oh my gosh, why didn't I know that? Because the show is really about you and your well-being and professional and personal growth that allows us to not just be effective helpers in our shared profession, but also to enjoy it and experience love, happiness, and success for yourself because you deserve that too. So let's roll right in about how and why to always be assessing. We all know that therapy, the arc of growth, it's a journey, right? And we also know that when our clients are starting therapy or coaching for that matter, they are often coming in the door with very specific presenting issues. If it is a therapy client, they probably have mental health concerns at the forefront. They're dealing with anxiety, depression, PTSD, they're grieving, but there's a specific trigger. If we have coaching clients wanting our help, it's also usually for a specific reason, seeking improvement in their relationship, being able to actualize important goals or get clarity about their career. But like we're here for a reason. And at the onset, these are the concerns that obviously we're attending to. This is what dominates the conversation. And so we have clarity about our work. It guides our focus and it also guides our client's focus. And as we both know, we're often able to help our clients make substantial progress on their initial presenting concerns in a relatively short period of time. I mean, few months. It's not overnight, obviously, but like 3 to 6 months most of the time. If we're doing a good job and our clients are responsive, like they are getting traction. They are on their way. And that is not always, though, when the therapeutic process or coaching process continues. Some people enjoy maintaining long-term relationships with a therapist or with a coach. And so that's why we need to be monitoring these relationships and continue assessing and kind of checking in about what's going on. Why are we here? How can I be helpful to you now? Because clients' goals and needs evolve over time. And it is also true that we can see subtle, but also sometimes pretty significant issues be emerging over time. And if we're not paying attention and thinking about these things, they can go unnoticed until they surface in sometimes unexpected ways. And so any therapist worth their salt is typically, or coach worth their salt is typically doing a lot of assessment at the beginning of relationships. And that's our training, right? We are here as, if we're operating as therapists, we are here to evaluate, assess, diagnose for any mental health conditions, develop treatment plans. And the same is true for coaching. At the outset of a coaching relationship, we're doing a ton of assessment to help clients get clear about themselves, their values, their goals, what they want, and then we're turning that into action plans for how to create it. And then months go on, years go on, and what does it turn into? Ongoing assessment is equally critical throughout the process of growth if you are going to maintain relationships with clients. And I will also tell you something with love, that one of the most important ethical assessments that we can be doing with clients that we've been working with for a while is this. It is asking, is this work still beneficial for you? When we first started seeing each other, you were going through this life experience, or you were dealing with this diagnosis, or you had this coaching goal in mind that you hired me to help you attain. You've made a ton of progress. I'm so proud of you. It seems like you're in a great place. Is there a basis for us to continue this relationship? In my experience and in my opinion, way too many therapists and coaches don't do that. They maintain relationships with clients who really no longer need their services or can really even benefit that much from their services out of complacency, sometimes a desire to keep their caseloads full. Like, no judgment, but it definitely happens. And so in order to be ethical and do right by your clients, it's very important that you are taking a leadership role here to say, what are we working on now? How can I be of service for you? And if your client is saying things like, well, I just really like talking to you and using you as a sounding board, maybe that turns into a goal of, thank you for telling me. And part of my ethical responsibility for you is not creating a situation where you're dependent on me for things like this. So how about the next chapter of our work is focusing on helping you create higher quality, more emotionally intimate relationships where you can have these kinds of conversations with your partner, with your friends, other important people in your life without relying exclusively on me to be your sounding board or emotional support system. How does that sound to you? Like, these are the kinds of doors that can open when we're doing a good job of assessing, and especially assessing that number one thing of, is our continued relationship still appropriate, and being okay when maybe it isn't. Because the other thing here is that if you're not proactively having those conversations and inviting your client to be talking about the reality of the fact that there is a time and a place to enter into this relationship and also a time and a place to end it ethically, your client may either develop unhealthy dependencies with you, or also show you how they feel and what they need through their behaviors rather than their words, like start canceling appointments or stopping coming to sessions without you having had the opportunity to handle that in a courageous way that allows you both to have a conversation about that and end your relationship on a very positive note and in a structured way with a termination session, which is ideally how we're operating. But even beyond that one fundamental assessment of why are we here at various points in time, there are other reasons why continuous assessment is incredibly important. And so one of them being to be able to kind of keep track of where your clients are in the process. I talked about this in a previous podcast related to how do you know if your work is helping your clients? You might want to check that out for more information. But part of how we monitor that and also, adjust our approach sometimes is by by and through our assessment process. And so to be able to monitor shifts, means having a means of assessing that so that you can be aware of subtle growth, even sometimes that your client might be making over time so that you're aware of it, but also that they're aware of it. That's why these assessments can be really helpful for both of you. That our clients' growth is not always immediately visible, that your clients might be making progress in areas that are subtle, right? Or that there might be other things moving around underneath the surface, and that these things can and will oftentimes remain hidden until a lot of trust has been built, the relationship deepens, and also, in my experience, is that when clients are coming in hot and they're really not feeling well, maybe they have a lot of mood type symptoms where they're depressed, they're anxious, they are not in the right place to be able to do deeper work. It's only after they become more stable, they feel more in control of themselves and their lives, then sometimes we start to have real deep breakthroughs around things like, old trauma, unfinished emotional business with the past. And while, they're not ready to do that work when they first come in, maybe year two, we can start to kind of sink into some deep, difficult, hard stuff that they really just simply were not ready to do. And so for you to be aware of just some of what those things might be, or, having this kind of curious mind, just being aware that there are things about your client that even though you've had a relationship with them for a long time, you legitimately might not know. And so, when your client is in a good, stable place, to just have it in your repertoire, to be, you've made so much progress. And in my experience, sometimes when people do a lot of this immediate work and they're feeling better, things can shift into a time and place where now all of a sudden we're able to kind of go deeper and maybe open some of those doors that needed to stay closed at earlier points in the process. Do you have any doors that we haven't opened yet, but that you suspect probably need to be? And they can say, no, and that's fine. But you know what? It gives them an opportunity to maybe say yes. So to have some of those power questions and just be aware of the fact that there may be other stuff going on. And of course, we all know, or should know, that particularly when it comes to major mental health diagnoses, depression, anxiety, and mood disorders, it isn't a fixed state. These things tend to be episodic. They ebb, they flow in response to different things. And so you may have a client who's done a lot of great work and who has become very stable and who still has vulnerabilities. And just to be aware of the fact that, depression can start to sneak back in, even if people have been feeling pretty good for a long time. And maybe even the work has moved on to other things. You've had a client who first started seeing you about their depression and has gotten that under control. And then truly, their needs and their interests have shifted into, how do I feel more effective as a parent, or how do I have a better relationship with my partner? Like their things evolved, but that doesn't mean that depression isn't ever going to come back. And so for you to just be aware and sensitive to the fact that they may have some of those things sneaking back in, and just to be checking in about that once in a while so that you can both understand if maybe we need to shift back into focusing on their mental health and wellness as opposed to more circumstantial or life goals that may have taken more immediate precedence. Additionally, another important reason to always be assessing is because this onion oftentimes continues to peel. We have a client coming in for anxiety or depression. They stabilize, they start to feel better. But then once that stabilization is in place and they can go deeper, it may may be that it was underlying trauma that was really the engine of a lot of the anxiety or depression, and that this can take months, and in my experience, sometimes years to surface, because your clients may legitimately have not been ready to confront or acknowledge the trauma, or I think that self-awareness is often built over large periods of time. And so our ability to be keeping track of what's going on with clients helps us notice when our clients are starting to feel safe enough to dive into some of these bigger wounds. Trauma is one, but also grief is another. Grief can be very elusive and multifaceted, and sometimes, frequently even, people will experience a delayed emotional response to a significant loss, or they might not initially recognize how deeply a past loss has impacted them. So they come in with, anxiety, but then over time, as that fades, what's left for us to deal with as the therapeutic relationship develops is that unresolved grief that starts to emerge in unexpected ways. And that can show up all kinds of different ways. Dreams, somatic symptoms, shifts in mood or behavior, just making contact with deep sadness, but making sure that you are operating in a way that you are intentionally looking into what else may be underneath the surface, even after your treatment has been going on for a while, because a lot of times these things are sleepers. And then lastly, there are some things in particular, like personality disorders, complex PTSD, that from my experience, my perspective, can actually take a considerable amount of time, sometimes a longer relationship, for you to get the full picture of what is really going on with some people, and that it is difficult to really get a full picture of someone after knowing them for only a few weeks or months. And this is particularly true when people are coming in for things that may not directly be related to these more profound or long-standing personality symptoms. They're coming in because of depression or problematic relationships or feeling frustrated with their career. But it's only through that ongoing assessment that you have the opportunity to see it clearly, because without that, it's very easy to misdiagnose or misinterpret some of the things that the people are showing up with. And these are complex diagnoses, but our ability to stay present and kind of actively monitoring will help us see them. And then so lastly, another important thing that we always need to be assessing for if we're operating as ethical and effective therapists is related to dependency. Over time, our clients may begin to develop a subtle but really not ideal dependency on us, especially in long-term therapeutic relationships. Now, obviously, there is a time and place for strategic dependency to develop. If you are in the thick of the work with a client, you want them to climb on board, so to speak, and really bond to you. That's what we do. We have relationships with people, and that dependency can be part of the healing process. There is also such a thing as reparenting someone, and when you are truly in the meat of it, it's okay, and you, I think, don't need to worry about having a client be overly dependent on you if it is appropriate, given the nature of the work that you're seeking to do at that time. However, we need to be careful that we do not let that go on forever. Remember, our work with our clients is for the purpose of their growth, their individuation, and their ability to be functional, happy, healthy on their own. We are here to work ourselves out of a job. And so it's very important that you're keeping track of, where is this person in the work? Is it appropriate for them to be dependent on me right now? Or have we done what we needed to do? And now my job to be of more service to them is to help them grow, cultivate other helpful, healing relationships elsewhere in their lives. And so how do I assess for that, the dependence, but also the presence or absence of other relationships? So these are all important things to be aware of, but the dependency one can be one of the trickiest. And there might be a lot of different techniques that you use to gain visibility into that. But for me, I'm always thinking about, does it seem like my client is reluctant to make major life decisions without talking with me about it? Do they feel like they need to process things with me? What does that give me visibility into? And maybe that my client needs to develop some additional skills that help them feel more independently functioning, because we are not doing anybody any favors when we are creating unhealthy dependent dynamics. Another thing that's important for us to be keeping track of in our relationships with longer term clients are shifts in things like identity, values, belief systems, remembering that people grow and evolve substantially over long periods of time, and particularly when they're invested in powerful growth work or healing work, as you may be doing with your clients. And so that to be keeping track of the fact that the person that you originally connected with a year or 3 ago may be different than the person that you are in relationship with now. And this can extend to identity. This can extend to values, belief systems, because as our clients become more in touch with their authentic selves, they might experience significant changes in their personal or professional lives. And so we need to be following our clients all the way and never assume that even the things that were important to them, the goals or the hopes that they had when we first embarked on a relationship, are still the same for a person a year or 2 in. And so regularly assessing who your client is now is going to be an important part of any therapy work, and also especially if you are a therapist who operates as a coach as well, understanding that goals will shift and evolve. One set of goals is attained, and then that opens the door to a whole new chapter of things to pursue that may be attached to values and goals, ideals that are actually substantially different than they were when you first connected. So dig back into that and make sure that you are still in alignment and accurately understanding the person that you are working with now. And then very lastly, one last thing, and then we'll wrap up. I cannot overestimate the importance of paying attention to addictive or compulsive behaviors, even if you asked about that in your first few sessions and are like, nope, I'm fine. In my experience, clients, humans, everybody, we develop attachments to different things that, particularly if somebody is not interested actually in changing that behavior, they will often seek to protect their attachment to a substance or a certain behavior. They will shield it from your knowledge because they don't want you to know about it. Because if you did know about it, then they might have to do something to change it, and they do not want to do that right now. And that's okay. They don't have to do anything, and they have the right to tell you only what they want you to know. But I have had this situation on more than one occasion where Only after a substantial amount of time will clients, begin to show me a little bit more about some of the things that they had previously wanted to keep hidden. Maybe they are, moving into a place of ambivalence where previously they did not have ambivalence. They were like, no, I want to keep doing this. And that we need to be sensitive to that, but also recognizing that many times too, clients will have a lot of shame around some of the things that they're doing, or some of the things that they're attached to, that it takes a fairly long-term and emotionally safe, trusting relationship for them to feel safe enough to share them with you. And ideally, to share them with you and feel brave enough to say, I don't want to do anything about this right now, but I want you to know that it's here and that I might want to talk about it sometime, but not now, maybe later. Like, it's all right. But just to be aware that that is not uncommon, and just to think about ways that you can very gently just kind of check and test if there's something there. And of course, always maintaining that unconditionally positive, non-judgmental stance of the fact that it is all okay. And, timing is everything, and you don't have to tell me about anything or work on anything unless you want to. Like, this is about you. So, I'm following you. That is the stance of a therapist. All right. So I do sincerely hope that this discussion of why we need to always be assessing in our therapeutic relationships and in our coaching relationships is very important. And I hope that, just this discussion helped push you back into contact with things I'm sure that you already know and probably already do a lot of. But I just wanted to float this conversation because these are the kinds of things that therapists, in my experience, like we do so much work on ourselves when we are entering this field. We go to graduate school, we go into supervision, we become licensed, we do postdocs, we do a lot of training and things. But then, after years go by and you kind of mature in your profession, it is very common for most therapists, particularly those who are in private practice, to start floating, like we stop being connected to those systems. Sometimes we stop having spaces available to do our own work or to think about these kinds of things. And yeah, we're required to do continuing education credits, but in my experience, that isn't always pushing us into where we really need to go many times, which is into these self-of-therapist spaces that we were talking about today, but also going into, I think, some of the more macro things that we just all need to remember and do and reconnect with our why and our how. And so thank you for allowing me today to be part of that ongoing support system for you, my friend, because as a helper, you need support. You need to be learning and growing. You need to have your cup filled. And that's why I'm here. And I hope that's why you're here. And so thank you for allowing us to have this moment. And as always, if you got anything out of this today, if you received benefit from it, please share this with somebody in your professional network, because there might be another helper who is not in my orbit, but who is in your orbit, who needs to have a space where they can connect with the ideas that we were talking about today. We can't do this alone. We need community. We need each other. Thank you for being part of my community, and pass it on. All right, my friend, thank you. And I will talk to you again soon. I'll be back next week. Take care. And on that note, if we are not officially connected yet, come find me on LinkedIn. Let's be friends on LinkedIn. Dr. Lisa Marie Bobby on LinkedIn. Send me a friend request. We will hang out. And I, of course, would love to hear questions, comments, feedback. If there are topic ideas for other podcasts that would be helpful for you or your community, I want to know, because I'm making these for you and I want to make sure that they're helpful for you. So let me know what's on your mind. All right. Thanks again so much. And I'll be back in touch next week with another episode of Love, Happiness, and Success for Therapists.